Welcome back. In this video, we will go over the muscles of the lower extremity, the thigh and the leg. First, let's identify the bones on the figure. This right here is the 12th rib. We can see the 5 lumbar vertebra. This is the iliac crest on the ilium of the hip bone. That is the anterior superior iliac spine. We can see also part of the hip bone, the pubic, that's the pubic symphysis right here, the patella and the patellar ligament. The lower extremity in this figure is in the anatomical position. Based on that, this is the lateral aspect and this is the medial aspect. Starting with the first muscle, this is the quadratus lumborum muscle. Quadratus, it has 4 angles. Lumborum, it is related to the lumbar region. Next, we have the psoas minor muscle. So this is the psoas minor muscle. Right underneath it, we have the psoas major muscle. The muscle that covers the ilium bone, this is the iliacus muscle. Both the psoas major and the iliacus muscle, they form the iliopsoas muscle. This right here is the tensor fascia lata muscle on the lateral aspect. Moving medially, this muscle is the pectineus muscle. We can see part of the pectineus muscle right here. Notice how it is attached to the pubic region of the hip bone. Next, we have the adductor longus muscle. Adductor longus muscle, it helps us adduct the lower extremity. When you add something toward the midline, this is adduction. Abduction, when you move the limb away from the midline. That is the adductor longus muscle right here. Also, we have the adductor brevis muscle. Brevis means short. It also adducts the lower extremity. And we have the adductor magnus muscle. We can see the adductor magnus muscle, which lies deep to the adductor brevis and the adductor longus. So we have 3 adductor muscles: adductor brevis, longus, and magnus. This right here is the gracilis muscle. The gracilis muscle, it forms a V shape with this muscle that runs diagonally, which is the sartorius muscle. So this is the sartorius muscle. Moving to the quadriceps femoris muscle. Quadri from 4 ceps, heads. Femoris, it is in the femur, around the femur, in the femoral region, right? Biceps, 2 heads. Quadriceps and triceps, 3 heads. So the quadriceps femoris muscle, it consists of the rectus femoris muscle and the vastus lateralis muscle. Lateralis, this muscle, it runs laterally right here, whereas this is the vastus medialis muscle. So the 2 vastus medialis and lateralis, they form a V shape. And the 4th muscle is the vastus intermedius muscle, which is deeper to the rectus femoris muscle. This is the gracilis muscle. So the gracilis and the sartorius muscles. We removed the rectus femoris muscle. Now we can see the vastus lateralis on the lateral aspect, the vastus medialis muscle, and this is the vastus intermedius muscle. Moving to the posterior aspect of the thigh, first we can see the gluteus medius muscle on the posterior aspect of the hip bone. This is the gluteus maximus muscle right here. This is the adductor magnus muscle. You can see part of it. This is the gracilis muscle, which is the most medial muscle. As we said, the gracilis forms a V shape with the sartorius muscle that runs diagonally, anteriorly. This right here is the iliotibial tract. Moving to the biceps femoris muscle. So in the upper extremity, we mentioned the biceps brachii muscle. In the lower extremity, we also have a biceps muscle, which is the biceps femoris muscle. It has two heads. This is the long head right here, and this is the short head. So we have the quadriceps femoris muscle and the biceps femoris muscle in the femoral region, in the lower extremity. Moving to this muscle on the medial aspect, this is the semitendinosus muscle. Right under the semitendinosus muscle, we have the semimembranosus muscle. So both semitendinosus and semimembranosus are on the medial aspect. A way to remember that, they both have an M, so that is on the medial aspect, whereas the biceps femoris muscle is on the lateral aspect. The biceps femoris with the semitendinosus and the semimembranosus, they form the hamstrings muscles. It is called hamstrings because butchers, they use the tendon of these muscles to hang the ham for smoking. Moving to the muscles of the leg. Starting with the lateral aspect, let's first identify the bones. This right here is the patella. We can see the head of the fibula. As we mentioned in the previous videos, fibula, LA, is the lateral bone in the leg. So this is the lateral aspect. This right here is the tibia, which is the medial bone in the leg. First, we have the gastrocnemius muscle. Gastro, it has a belly. Cnemius muscle, we have two bellies. This is the gastrocnemius muscle. You can see part of it anteriorly. So that is the anterior aspect, and this is the lateral view. This right here is the soleus muscle. You can see the soleus muscle right here. This is the fibularis longus muscle. Fibularis, and the fibula is the lateral bone. So this is on the lateral aspect of the leg. That is the fibularis longus muscle on the lateral aspect. Whereas this is the tibialis anterior muscle. The tibia is the medial bone in the leg. We can see the tibialis anterior muscle right here. So fibularis longus, tibialis anterior muscle. Right under the fibularis longus muscle, we have the fibularis brevis muscle, which is also on the lateral aspect of the leg. We can also see the extensor hallucis longus. Extensor hallucis, it extends the big toe, the hallux region. It is on the anterior aspect, whereas the flexor hallucis longus, it is on the posterior aspect to allow us to flex the big toe. This right here, we have the fibular retinaculum, that is the superior and the inferior extensor retinacula. We can see the lateral malleolus, which is part of the fibula. This right here is the extensor digitorum longus. So we have extensor hallucis longus and the extensor digitorum longus. This is for the digits, the toes, and this is for the big toe only. Both are on the anterior aspect. We can see the extensor digitorum longus right here. So that is the tibialis anterior. Then we have the extensor digitorum longus. Then we have the fibularis longus. And then we have the soleus muscle. This is the tendon of the extensor digitorum longus muscle. Also, we have the extensor digitorum brevis muscle. Brevis is short. It also extends the digits. It's on the anterior aspect. Moving to the posterior aspect of the leg. First, this right here is the medial aspect. We have the medial malleolus. This is the lateral aspect. We have the lateral malleolus from the fibula, medial malleolus from the tibia. This is the calcaneus bone. This muscle right here is the plantaris muscle. This is the gastrocnemius muscle. It has two bellies. That is the medial head toward the medial aspect of the leg. That is the lateral head toward the lateral aspect of the leg. This is the tendon of the gastrocnemius muscle, whereas this is the Achilles tendon, which is attached to the calcaneus bone. And this right here is the soleus muscle. Plantaris related to the plantar region, soleus, the sole of the foot. As we mentioned earlier, the semimembranosus, semitendinosus are the two muscles on the medial aspect of the thigh, whereas the biceps femoris muscle is on the lateral aspect of the thigh.